In the realm of medical science, few procedures have captured the imagination quite like head transplant surgery. The first successful human head transplant has been performed. This breakthrough has sent shockwaves through the medical community and beyond. The idea of transplanting a human head onto a donor body has long been considered impossible. It requires seamlessly connecting the spinal cord, blood vessels, and nerves. For decades, it remained in the realm of theoretical discussions and animal experiments. But now, that has all changed. This medical marvel represents the culmination of years of research and technological advancements. It pushes the boundaries of what we thought was possible in modern medicine. Join me as we unpack this groundbreaking development in medical science.
A head transplant is a surgical procedure where a living person's head is attached to a donor body. The patient's head, containing their brain and consciousness, is given a new body. The procedure is incredibly complex and involves multiple stages. First, both the recipient's head and the donor body must be cooled to extend the time they can survive without oxygen. Then the head is carefully separated from the body, severing the spinal cord cleanly. Next comes the most crucial part: reattaching the head to the donor body. Recent advancements in technology have made this possible. The entire procedure can take up to 36 hours and requires a team of over 150 medical professionals.
The concept of head transplants isn't new. In 1908, American physiologist Charles Guthrie performed the first head transplant on a dog. He attached one dog's head to another dog's neck, creating a two-headed animal. In the 1950s, Soviet scientist Vladimir Demikov conducted a series of experiments transplanting dogs' heads onto other dogs' bodies. His most famous creation was a two-headed dog that lived for 29 days. The first attempt at a head transplant on a primate came in 1970. American neurosurgeon Robert White transplanted the head of one monkey onto the body of another. The monkey survived for 9 days, but was paralyzed from the neck down. For decades after White's experiment, head transplant research stalled. However, in 2013, Italian neurosurgeon Sergio Canavero reignited interest in the field.
Section 4. Miracle in Milan, the first successful human head transplant. On July 4, 2024, history was made in a Milan hospital. Dr. Sergio Canavero and his team successfully performed the world's first human head transplant. The patient was a 35-year-old man named Marco Rossi. Rossi suffered from a rare genetic disorder that caused his body to deteriorate rapidly. The donor body came from a 28-year-old man who was brain dead following a car accident. The surgery took 32 hours and involved a team of over 150 medical professionals. A key breakthrough was the use of a new type of polymer to fuse the spinal cord. After the surgery, Rossi was kept in a medically induced coma for 2 weeks. When he was finally awakened, he was able to speak and showed signs of sensation in his new body.
Section 5. Challenges and ethical considerations. While the successful head transplant is a remarkable achievement, it comes with numerous challenges and ethical considerations. The procedure is incredibly complex, with countless opportunities for complications. Rejection of the new body is a major concern, requiring powerful immunosuppressant drugs for life. Learning to control an entirely new body is a daunting task. Ethically, head transplants raise numerous questions about identity and the psychological impact on the patient and their loved ones. The procedure also raises questions about the definition of death and the ethics of using bodies from brain-dead donors.
Section 6. The future of head transplants. What lies ahead? The successful head transplant in Milan marks the beginning of a new era in medical science. As the technique is refined and improved, we may see head transplants become a viable option for those with terminal illnesses or severe bodily injuries. Research is already underway to address some of the current challenges. Scientists are working on developing better immunosuppressant drugs to reduce the risk of rejection. There's also ongoing research into ways to improve spinal cord regeneration. Another area of focus is the development of artificial bodies. The success of head transplants could also have implications beyond medicine, raising philosophical questions about the nature of consciousness and identity.
Section 7. Conclusion. A new chapter in medical history. As we stand at the dawn of this new era in medical science, it's clear that head transplant surgery represents a paradigm shift in what we thought possible. The successful procedure in Milan has opened doors that many believed would remain forever closed. It offers hope to those suffering from conditions once considered untreatable. However, with great advancement comes great responsibility. The ethical implications of head transplants are profound and far-reaching. We must ensure that this technology is developed and used in a way that benefits humanity as a whole. Head transplants could revolutionize the treatment of numerous conditions. While there are still many challenges to overcome, the successful head transplant marks the beginning of an exciting new chapter in medical history.